Hello, I'm Nick Cater for the Menzies Research Centre. Before we start this edition of Watercooler, I just wanted to tell you about that QR code over my shoulder. No, don't worry, we're not asking you to check in, but you can click on that and get through to our subscriptions page where you can become a subscriber to the Menzies Research Centre from just $10 a month. That way you can help support what we do and ensure that we can continue doing these Watercooler programs long into the future. And now, on with the discussion. Welcome to the Watercooler Forum, coming to you from the Menzies Research Centre, a place for the free exchange of ideas as we search for the solutions to the problems that vex us every day as a nation. This week, messing with our heads, the impact of the pandemic on mental well-being. Human beings, as we know, are inherently social creatures who thrive in company and often struggle when they're alone. Yet the extreme social distancing measures we've been forced to adopt are expressly designed to keep human beings apart. Sure, we understand what we're trying to achieve by limiting the opportunities for the coronavirus to spread, but there are bound to be unintended consequences and unforeseen costs, as there almost always are when governments devise novel solutions to complex challenges. We've talked a lot about the economic costs in recent weeks, but in today's discussion, I want to move on to the human costs. Joining me via Zoom is psychologist Dr. Belinda Khong, Dr. Fiona Martin, who worked as an educational and developmental psychologist before entering Parliament at the last election as the member for Reid, and Pete Shmigel, a former senior state and political advisor and a former CEO of Lifeline. Welcome to you all. I'll go to you each in turn, maybe starting with you, Fiona. Is it really a complete substitute for physical social contact, or are we missing something, and do we have to work out how we get back to a normal world of human contact as quickly as possible?
Yeah, well, I think technology has been an absolute massive help during the pandemic. Obviously, we wouldn't have been able to keep a lot of health appointments going if we didn't have telehealth services, for example. But it's also an important way of keeping connected with loved ones and members of your family. Just the other day, my son turned 12 years old and we had a family Zoom party, which was, the only way we could connect at the moment. So I think it's very important that technology is around, is available and accessible to all Australians, particularly during this prolonged lockdown in New South Wales. A lot of psychologists and people who work in mental health would have used a little bit of telehealth prior to the pandemic, but certainly the pandemic has forced all of us, into using technology more and more. And I think what it's shown is that it's created a lot more accessibility for a lot of patients, in the sense that, people who are in remote regional areas who may not have been able to access a specialised psychologist or psychiatrist in the past because of distance can now contact and book an appointment with a specialist in Sydney. And it's seen as more acceptable now. It's not a replacement for face-to-face consultations, and certainly it has limitations in terms of establishing a therapeutic relationship, and certainly there are limitations in terms of being able to do assessments of patients online, but it is much better than going without therapy for a period of time, and it's certainly essential during lockdowns, because we know lockdowns have an impact not just on our sense of connection to people, but loneliness, and certainly it impacts on our mental health.
Pete Shmigel, as a former CEO of Lifeline and somebody who's involved in a number of mental health charities now, is the overall effect of having all this digital technology at our disposal, is it good in the sense that we can help people at least to some extent get over loneliness, or is it bad in that it separates people? We've read a lot about the effects of social media on young people, how they can feel excluded or can feel bullied online, all that kind of thing. It's a big question, but give me your assessment are we better off now than we were 20 years ago?
It is a big question, and it's a very active question in mental health circles, the use of technology in terms of therapeutic relationships and relieving people's emotional distress. So just on Fiona's point, absolutely, it's extraordinary how telehealth around counseling and psychological support has become the norm increasingly. So in March of 2020, the share for telehealth on a national basis of Medicare funded visits was about 3%. And at the moment, as of April, we're sitting on somewhere near 30%, even higher in places like New South Wales and Victoria, which have been particularly subject to lockdown. And Fiona's right, that extra access is no doubt doing good for people. But the issue of technology is a broader one. In the same way that technology can deliver greater access, can deliver more services to some folks who are in need, as you mentioned in your question, technology for some cohorts in the community actually goes the other way. So at Lifeline, for example, we once did a survey and we found fascinatingly that social media, the respondents, about a third of them said that social media improved their lives. They could get access, for example, to mental health information according to social media. A third basically said that it actually made them feel more lonely. And a third didn't have a view, particularly one way or the other way. So my view is that the jury is still kind of out when it comes to technology being either a net positive or a net negative when it comes to mental health care. At the end of the day, you can't replace people with machines.
Indeed. Belinda, Khong, if we could just stick with technology just for a second. In your experience as a consultant psychologist, you must be aware surely of technology and social media and so forth creating strains and stresses in people's relationships and indeed in their own mental well-being. What's your assessment of this?
So let me confess, I am of the generation where telehealth is a challenge, right? And I am so used to, like what Pete say, the face-to-face, and like Fiona said, looking the client in the eye. I think that as long as we make a distinction between technology as a tool, as an instrument of facilitation rather than a journey or a destination in itself. So, when the young people start to compare, I've got iPhone 10 and you've got iPhone 6 and it becomes a competition, then I think it has its problem. But in the therapeutic context, myself and a lot of my colleagues, where we deal with not only, say, depression and anxiety, but psychopathology, suicidal clients, paranoia and schizophrenia. I can tell you it is very, very disconcerting and very stressful for the client and the therapist when the client tells you on the end of the Zoom, you know what, I am feeling suicidal. And you start to assess their level of suicidality, and you find that they have a gun or they've been checking the internet for knives and this and that. What do? Do you rush over there and says, normally we would start to talk to them while we get the mental health team in there and things like that. We don't have that facility because you're at the other end and they could be in, I don't know, in Emmerdale or something. So I think that it has its limitations in the sense that for serious pathology, I think that telehealth is an obstructive instrument, right? Because once you have the knowledge that your client is suicidal, as a psychologist, you also have the responsibility. I think the government that look at mental health and all that has to look at where the responsibility for keeping them healthy and keeping them safe, where that differentiates.
So advantages, we need to be aware of the limitations. Fiona, to come back to you on this, I think what we should perhaps do first of all is to try and get an assessment of how big the challenge is to mental well-being because of COVID. And mental health is always often very hard to spot and detect. It's often happening inside people's heads. It's not like they turn up at the surgery with a broken leg or something. So you've got that obstacle. We've also got, social distancing. A lot of this is happening presumably amongst people who are alone and not having a lot of contact with people. I find, I don't know about you, but the statistics around this, mental health statistics, are often lag indicators. They often take quite a while to assemble, and even then it's not a full picture. Just give me your assessment, Fiona, about the scale of the problem and the type of the problem that we may be facing now.
Yeah, well, I'm recently been appointed the chair of the Mental Health and Suicide Prevention Committee, and we've been doing public hearings across Australia. And the evidence on this is pretty clear that there has been a significant increase in the number of people seeking help during this period, both last year and this year during lockdowns. And I think that it's, the sheer number of phone calls to helplines, for example, Lifeline received the highest number of calls that it's ever received in its existence. But all the psychologists and psychiatrists and GPs and specialist emergency department physicians have all said to us that they've had an increase in the number of people seeking assistance at this time. Now, interestingly, we haven't had an increase in suicides, which is promising, but I don't think that we can rely on that because, as you rightly pointed out, sometimes the impact of lockdowns and the stress of the pandemic can take its time to play out. So whilst there might be urgent mental health issues to attend to right now, we need to consistently provide that service to people over the next, I would say, 5 years, because the impact of the pandemic will last a significant period of time. And the sorts of things that we're going to see are, for example, children who are missing out on experiences in social and emotional development, young children, for example, who would be, meeting certain milestones right now in their social and emotional development. And also, of course, there is just fear of contracting coronavirus in and of itself. People are living with that fear daily. And we're seeing people, burst into sort of anger when they're, walking, hearing reports of people bursting into anger when they're walking in the streets and someone's not wearing a mask or whatever, or not complying with certain rules. So that's creating a lot of agitation in the community. People are very fearful of contracting coronavirus. And I think that in and of itself, and the fact that we're worried about our family members, particularly family members who are, vulnerable in some way. And we haven't seen family. My electorate of Reid is one of the most multicultural in Australia. And my constituents haven't been able to see immediate family members who are overseas. And that in itself has been stressful because some of my constituents have got parents or grandparents in other countries around the world that they really would like to be able to, help during this time. And of course, they've all experienced the pandemic as well. So there's been a lot of stress and anxiety around being distant from family members and close friends. It's been a very difficult time, I think, all round.
I want to come back to that point about fear, because I think this is a very big factor we need to consider separately. But Pete, from your involvement with charities and your knowledge of what's happening at Lifeline, how extensive is the challenge we face?
Very, and I don't think there's any understating it. And Fiona wisely recognizes that there's an element in the emotional distress out there and the mental dis-ease out there that is stemming from fear of the disease itself and contracting it and its implications. And there's also, I sense, and I believe there's evidence to show that some of the discomfort, stress, anxiety, whatever you wish to deem it, it's different for different people, also stems from the COVID policies themselves, from lockdown. As Fiona said, people can't see each other. So just to give you a sense of some of the kind of structural changes we're seeing in our society as a result of both factors, the fear of the disease and the policies that respond to it. We've seen a 10% increase in mental health services across the country from 2019, averaging about 275,000 a week now. Interestingly, Victoria, the state that's been locked down the most, is 40% higher than any other state in those statistics. Also, the number of scripts, for instance, that have been issued for antidepressants and other mental health related prescriptions is now standing at about 800,000 per week. And that is about 10 to 15% higher than what it was in 2019, when it was about 725,000 per week. So I think we need to reflect that, yes, there is a disease, and it brings with it not only physiological and public health impacts, but there are also responses to that disease and how we tailor those responses that also have their own health impact. And the numbers are concerning. Fiona's right, suicide statistics have stabilized. However, Fiona, one thing that the committee should consider is that in New South Wales in 2021, they've actually increased by 4% now. So perhaps that's a sign that some of these mental health factors, we showed great resilience in the early phases of the COVID pandemic, but are perhaps now a little bit waning with fatigue, et cetera, and something to be very conscious of.
Mm.
Look, we all have, I think, to a greater or lesser extent, felt COVID stress, if you like. We can all identify with sudden bursts of frustration or even anger welling up. It happens to all of us. So that leads me on to the question, Belinda, which you're probably well placed to answer. How do we draw the boundary between just sort of feeling a bit down in the dumps, as inevitably you're going to be from time to time at a period like this, and actual mental health for which you need to have treatment and for which the government needs to provision?
Nick, that's a very good question. But
excellent.
Before I go into that, may I address the issues that Fiona and Pete has so succinctly brought up? I'm a fellow of the American Psychological Association. So I get a lot of data and resources and studies about how the Americans have actually coped with the pandemic and issues that we are now facing, because they are about 18 months ahead of us. And as I mentioned in the email, I find two studies which actually suggest some positive outcomes, and which actually suggest that maybe we should also include why people do not break down, and why people in the same environment do not suffer mental health issues, so that we actually have a holistic picture of the whole thing, rather than everybody is panicking, everybody is this. And these are two studies. One of them was in America. May I elaborate on the study, Nick?
Yeah.
Yeah, okay. So the first study was actually carried out by the American Psychological Association in 2020. And this was looking at the trajectory of loneliness during the pandemic. And they looked at nearly 1,600 people, of which half were men and half were women. And this varies from ages 18 to 95. So they covered a whole spectrum. And fortunately, it was just coincidental. They were looking at them before the pandemic because they were looking at well-being. So they started the survey in January of 2020. Then in March, when the White House announced social distancing, they actually interviewed the same people again. And then in April, when there was this stay-at-home order, right, they examined. So they had the same cohort over different things that we are facing. Now, the general findings are that there is no significant change in average level of loneliness over the 3 periods. It's a 6-month period. They found that older adults have found some increase in loneliness during the social distancing period, but less in the stay-home period, right? And they found also that during the pandemic time, people actually engage more and connect more with phone calls, video chats, and other connections. That was very helpful. And the interesting thing, which they did not, the researchers themselves confessed to be very surprised, older generation reported a higher level of life satisfaction during the pandemic than before the pandemic. The rationale being that when the younger generation and the families were busy, they could never get hold of them. They were always traveling, or they're this and that, and mom, sorry, I've got this deadline. Now they know where to find them. Now they just connect with them. And the children also call in and contact with them more. So they found there was a very strong emotional bond. And I think we really need to consider this in the government's policy. Now, the second study.
May I ask a question, Belinda, about that study? That was all people self-reporting to a survey, correct?
Yeah, this it's all quantitative, and as I will say to Nick later on, we need to actually conduct more qualitative, more neon studies.
But my point is, it's essentially researchers calling somebody and saying, how are you feeling, as opposed to their actual behavior of turning up to a psychologist or asking for a script or calling a crisis line.
Sure. But I think the general point that this study was that at that time in America, when the start of the pandemic, every article, every social media was saying how bad it was. And when they actually went down and looked at 1,600 people over 3 different periods, they found that actually it's so qualitatively refined. And the surprising thing is, they said that the older people said, actually, I know where my children are, I know where to get hold of them. And I think that
I'm not trying to challenge the validity of this study or you bringing it up. It's just that there is an element of tragedy taking place in Australia right now that's borne out not by survey work, but by presentations. So for example, in emergency rooms in New South Wales, and I'm based here in Western Sydney, where this statistic is higher than it is anywhere else, we've seen a 47% increase in teenagers turning up with suicidality in emergency departments. That's extraordinary. That's 7,500 children turning up with suicidality. And I'm not sure that we can somehow say, oh, things aren't that bad.
No. Pete, don't get me wrong. I'm not saying that at all. In fact, being a psychologist, I see so many suicidality and all that kind of thing that, if I were not to have my own children and things like that, I would think that half the population is going to go crazy, right? So we also have to look into account the fact that the hospitals, the emergencies, and people like us are actually seeing a very, very special, distinctive population, right?
Sure.
Yeah. So let me get to the second study, and then I will kind of summarize why are the findings so different from what the media is saying, okay? So this second study is actually done for Lancet, and Lancet is a very big medical journal. They actually had a task force, and they appointed a lot of the well-known psychologists to do, and they looked at 1,000 studies who look at depression and things like that. And they also looked at the World Gallup poll across 21 nations, over 100 countries. So I know it is very quantitative. I'm a qualitative researcher myself, so I find statistics don't tell the real story. But what they found was that in the beginning of the pandemic, and this is related to when they have winter, the stress level was quite high. Come summer, in the summer of 2020, the level of distress and psychological distress was less, right? So we have to take into account, for example, when does this happen? I mean, all I'm saying is it's so fine line, right? But more importantly, what they found was that human beings have what they call a psychological immune level, where they actually use their own cognitive level to come up with creative solution to manage their own stress. Like, for example, like drive birthday parties, baking and all that thing. And the social connection does not rely on the physical connection. So what they are saying is that, and this is what the Lancet have found, that people can actually handle temporary changes to their lifestyle, right? And not travel and all that, provided they can find a connection and provided they can find purpose and meaning. That people are actually more resilient than what the social policy makers have given us. We have not tapped into their resilience. We have tapped into their distress. And I think there has to be a balance between resilience and distress. That's my main takeaway.
Yeah. I think it's important to realise, Belinda, that we are of course dealing with human beings, and every human being is different, and I guess we have to take pains to try and get to understand who is particularly vulnerable in this situation, who isn't. But moving on to this sort of overwhelming sentiment which you feel in the community, you feel it when you listen to talkback radio, you feel it when you run into people in the streets. Fear. There is a great deal of fear out there of the virus. I think it began in the early days. We had some forecasts that fortunately turned out to be much larger than actually occurred, but people could see what was happening, they could see what was happening overseas, etc., etc. It seems to me, Fiona, that what's happened is that politicians, as good politicians do, respond to sentiment in the community. But in doing so, we got trapped into this sort of cycle of fear in which there's a danger we put aside rational considerations or the trade-offs that are required in every public policy response between, say, the economy and jobs on the one hand and public health on the other. Do you think that this emotion of fear has been positive or negative? And to what extent now at this stage in proceedings can we do anything to calm fears if that's what needs to be done?
Well, I think all the way through this, it's been a delicate dance between balancing the risk of COVID spreading throughout Australia and also the impacts of the policy interventions that required lockdown, social distancing, all the health messaging. It's always been very difficult to balance that. Australia didn't have the sort of a big wave of COVID in the beginning like other countries did, and so we were in some ways, we're sort of a victim of kind of our own success, in the sense that because we didn't have that impact early on, and now we're experiencing, it's kind of hit us hard and fast. And so the fear in the community has, I think, come about because of the fact that we did suppress COVID early on. And now with the Delta wave, it's come on so quickly that has kind of ignited a level of distress within the community. I know within my own electorate, and having spoken to all the mayors and general managers and state members in my seat, that we're all working very hard across all political persuasions to reach out to the community, to encourage vaccinations and to encourage uptake at the moment. We're communicating the Doherty Institute's modelling, which I think is very important. We're translating the information into different languages, which is critical in my seat and Reid. And we're getting our cultural leaders to show, to take photographs when they're getting vaccinated, for example, and to lead in this space, because it's very important right now that we get as many people vaccinated as possible, because that ultimately will lead to fewer lockdowns, and hopefully in New South Wales we can get to the point where we won't have any more, and that's what we're working towards. But we've certainly been working that fine line between lockdowns and the economic impact. Small business owners in Reid are really struggling. We're doing a lot of whatever we can do to help and support them. I think a lot of people are very grateful for all the government support that's out there for individuals and businesses, and they've been been, writing in and telling me that they've been very helpful and that they wouldn't be able to get by without that assistance. But I do think people are still struggling, with, if it's not health issues or mental health issues, they're finding it difficult to cope being in lockdown, not being able to interact, especially young people. I think Belinda mentioned before about sort of that intergenerational impact of COVID, and it seems that maybe perhaps older people aren't feeling it as much. When I call my 94-year-old Nan, Nana, she's quite happy about, how her day rolls. Sort of not much has changed for her. She's a very resilient woman, let me tell you, having gone through wars and depressions and whatever else. So she's a very resilient woman, but at 94, not much has changed because of the lockdown. But for my young cousins in their early 20s and early 30s, it's having a significant impact on their mental health and on their sense of connection with others. And we knew before the pandemic that loneliness was one of the biggest social issues, public health issues of the 21st century. It's a significant issue for our society and a big issue for governments to address. Loneliness isn't about just having relationships with a lot of people. It's your sense of connection in that relationship. So it's a very subjective measure, and certainly something that's very important, because we know that people that are lonely are more likely to have health issues, and particularly mental health issues. So it's an important area of social public policy to address.
Yeah, I understand that, Fiona. But Pete, if I could just stay on this question of what is the fear of the virus itself doing. You've spoken about these alarming numbers of young people reporting to hospitals. To the extent that their concerns are a fear of the virus itself, and you'd have to think that is a factor. Shouldn't we be actually going out our way to calming their fears? So instead of scaring them with ads, try to scare them into having vaccinations instead of appealing to other emotions, because to do what's obviously a very sensible thing, and pointing out to them that under the age of 50, the chances of you dying of COVID are statistically insignificant. This data is consistent on that the world over. Doesn't stop you getting it. You may get.
Yes. To Belinda's point, we should be appealing to people's sense of resilience as much as their sense of despair, their sense of hope as much as their fear. And Fiona notes that the government is trying to do the delicate dance in the response between suppressing COVID numbers on the one hand, and on the other hand, not imposing too many costs or impacts on the community. And I, for one, think the government, both at the state and federal levels, has done a remarkable job of that if you look at it comparatively internationally over the period of the pandemic. However, I would venture to say that in the last few months, particularly with the lockdown in New South Wales, the political class at its very senior level, and these are all friends of mine, people I've all worked with, and the media class have frankly fallen into a fear vortex where it's kind of a race to the outermost reaches of fear. So one of the ways that manifests itself is this absolutely ridiculous notion of univariate analysis around policy in COVID. So the only number that seems to matter is, are COVID transmissions up or are they down? So today, for example, the media is screaming in hysterics that we're at 360, an all-time record in New South Wales. Well, maybe somebody should step back in the political class in particular and point out that those 360 new transmissions are 0.37% of everyone who got tested yesterday. 95,000 people got tested anyway. Let's put that the other way, to Belinda's point about resilience and hope and glass half full. 99.67% of the people who got tested yesterday do not have COVID, right? And so perhaps in our design of strategies, we need to think about, how do you build in that positivity? How do you build in that hope? For example, the lockdown here in my own suburb, I can't leave. what we've been told by the police minister is that we have to sit in our houses and we'll give you helicopters. Rather than actually working with the community, including the called community, including communities affected by post-traumatic stress from war zones, in the way that Fiona is in her own seat, to say, how do we design strategies that genuinely work?
I agree, Pete. And I think, Nick, to get to your point, I think the idea of being social and connected is a biological instinct. Right? It's what makes us human, is what makes us have sex and reproduce, right? And then we have the other existential anxiety, right? Fear, which is to keep us safe. You know, you get a tiger, you run, right? So we are actually dealing with two very biological instincts, one to survive and one to procreate. Now, I mean, I'm putting it at a very gross level, right? Now, if the government has been focusing on the physical distancing as a safety measure, you know, medical, otherwise. And then you have people that says, but I need to see my grandmother, I need to know she's well and everything. You will get people breaking the rules because that need for connection is so strong. Now, when I mentioned about resilience and all that, and I'm glad Pete put up this point, because when I see clients and I see a lot of teenagers, Pete, the first thing I do when they walk through the door, I go up to and I shake their hands. And I say to them, thank you for coming to see me. Because I know it takes a lot of courage to actually say, I need help, right? And then when they tell me that they're suicidal and that this, and I say, that's one part of you. I would like to talk to the part of you that didn't commit suicide and are sitting right in front of me and telling me I need help. Now, in a very large way, we need to reach out, like Pete said, we need to reach out to the 99.9% that actually did contract COVID and said, my goodness, how did you avoid contracting COVID? And I think from that point of view, the media has a big responsibility to show good news story. We hear bad news stories all the time. We had that. And then we see, and I get very, very upset. I see the journalists haranguing the Premier, Brad Hazzard and Dr. Chen. They're doing their best, right? And all they do is, I got your moment. You did not announce these numbers yesterday. These numbers are actually two more than you said, right? Mm-hmm. How about Premier, you're doing well. I would like to see a journalist, and I've said that to you many times, Nick. I would like to see a journalist or a columnist or a commentator with a very good EQ that says, you know what, Premier, we're on all this together. How can we collectively promote a positive message to the community? Not the Western Sydney community, not North Shore, as a community. So the media and the commentators have a collective responsibility to make people feel less fearful. It's not just the government, it's everybody has to feel less fearful.
Well, here's some good news. Since January 1, we've had, I think, roughly 12,000 cases and still less than 40 deaths. So we're talking about a fatality rate there of about 0.5%, which is very low, and it's lower than it was last year. So we're safer. I mean, we are manifestly safer in that we've got protocols in place.
Not just a safety thing, but good news, like the restaurant cooking and says, I don't want to throw away food, right?
Sure, okay. But let's take this on. What I'm coming to is the question of risk. We've taken very, very severe measures, public health measures, a kind never ever been seen before in this country. Measures that some of us would have thought would never get to the point of having to take, but are they proportionate to the risk? So Fiona, answer me this: why is it that with less than 40 deaths in Australia since July 1, we're in this very, very severe state of lockdown in large capital cities? Britain in that same period, 2,000 deaths over that same period. Us, less than 40, them 2,000. But they've declared Freedom Day, they're opening up, and the vaccine is part of the story, sure, but there have been 2,000 deaths and people have been prepared to live with the danger at that point.
Well, I think it's important, firstly, to say that, if we didn't follow the health advice, what would the death rate be? And not just focus on the actual death rate. So it's important that we've all been working very hard to follow the health advice, and that's probably why we haven't had the death rate that we've had. That Australians have listened and followed the advice, generally speaking. I think the other thing is that, we've had in recent times, we've had an increase in uptake of vaccinations, which is important. We're working very hard right now to increase that, and I'm really happy to see that in my community in the inner west of Sydney that it's tracking consistent with the at least just above the average of the New South Wales stats in vaccination rate. So that's improved, and I think that's important. Look, I think that this has been a moment where we've all worked together, and I think Australians should be proud of that. We've got very good committees and experts that we can rely upon as decision makers. Our health minister doesn't make decisions on his own. He has, the TGA, he has the ATAGI, expert medical committees. It's not just one person making these decisions. It's a whole government, and not just one level of government, at least two levels of government involved. So it's about collaboration. It's about relying on expert advice and balancing that with the impact and welfare on Australians across the country. So it's not just an easy one person decision here. This is about teams of people, experts in this area of infectious disease, and relying on good data to inform decision making, not to make the decision for us. Data doesn't make the decision for us. It informs us on how to make decisions, and that's important. And everything gets weighed up. And certainly we don't want to be in lockdown unnecessarily, but this is about saving lives and keeping people alive. And I think that there's always, as I said from the beginning, it's been a delicate dance between keeping people alive, not having unnecessary deaths, but also to keep our nation moving. At some point, we will need to open up, and we will need to live with COVID. In the UK, I think the 65% or around about vaccination rate was considered acceptable to have Freedom Day. In Australia, with our 4 phases, we're looking at around 70% before we ease lockdowns across the nation. Of course, in New South Wales, Premier Berejiklian is talking around 70 to 80%. Well, we'll see. When we get closer to that, I think there will be a bit of room for negotiating, to be honest, because I think that as we get nearer to what was good enough in the UK, it should be good enough in Australia as well.
Pete, look, pick up this question for me of trade-offs. You're in public policy. You used to work as a government advisor. You do this all the time with public policy. You look at costs and benefits. Now, the benefits here are terrific. We get those. We can stop this wretched thing spreading. Our whole lives will be better, and we prevent people dying or serious illness. We get that. But there's a cost. We've talked a lot on this program about the cost to the economy, but today we've highlighted, and you in particular have highlighted, that there's another huge cost to be paid in terms of our mental well-being.
Yeah, I mean, just to give you another statistic before I comment more broadly, according to the government's own researchers, the AIHW, who are charged by the federal government for monitoring mental health impacts during COVID, levels of psychological distress amongst young people are up from 14% in 2017 to 22% now. That's 700,000 young people. That's more than Tasmania. So on to your question of, have we done the trade-offs correctly? Is the delicate dance being danced appropriately? Again, we have absolutely achieved important things in terms of reducing the number of transmissions by listening to precisely the people that Fiona nominated, to health experts, specifically to epidemiologists and public health experts. My concern is that in making those decisions for all of our society, for all of our economy, for all of our demographics, has government sufficiently listened to expert sociologists? Has government listened to expert psychologists? Has government listened to expert economists. And I would suggest that, unfortunately, in the context of this groupthink and in the context of this univariate analysis that says the only number that matters is transmission up, transmission zero, those folks have been muted. And as a result of that, advice going to government is one-dimensional, and we're paying these excessive costs as a result. It is time now, as New South Wales has 360 extra cases today, for us to really question, are we going to double down on a lockdown that's not actually producing results? Or are we going to be smart and bring cultural communities into the room and bring psychologists into the room and design a strategy that's more targeted, more sophisticated? Last example, the suburb next door to me is Rydalmere. We have one active case. We're in full lockdown. Bronte has 4 and has no lockdown. Come on. Yes, let's follow the data.
Belinda, I want you to pick up and take that where you will, but I also just throw in another.
Sorry, can I, before you throw me another question, can I just jump into this, because this is something very close to my heart. That while we're talking about policies and numbers, and I totally agree with you, Pete. As I said, I'm a very qualitative person, right? I think that we also have to take into account between the numbers, the figures, the stats, the medical thing, there is the actuality of the people's experience on the cold front, on the ground. Like I was giving Nick the example, when I heard that, maybe Gladys might extend 2 weeks lockdown, right? I have IGA across the road in Taramara. And I said to my daughter, I better go across and grab some food and vegetables and all that kind of thing in case I'm stuck here. She said, no, Mom, don't do that. I will order for you online. I said, the cabbage, by the time they reach me, will be bad. Right? She said, no, you shouldn't go. Now, I'm saying that this fear is real for my daughter, because we get things like, you're in this age group and that age group, right? So the point I'm making is, yes, we need to get sociologists, we need to get ordinary people to say, you know what, like Fiona said, my grandmother is so resilient. She's 94, she's been through the Second World War, blah, blah, blah. I will probably go before she does. Can we tap into what goes into my nana's head, right? Before I tap into just the 14 years old that is finding that they cannot get on the internet, they're so frustrated. We need to tap all generations who have lived through times worse than us, Nick. And what I'm saying is to just look at policy in isolation of people is not going to work, because the real people like my daughter are fearful. She won't even let me cross the street.
Well, this is precisely my point, is what I am making a lot of noise about in, whether it's in the Spectator or other places, is that now's the time to treat people as citizens, not as subjects.
As human beings, whether they're citizens or not, right, Pete?
Correct. And my concern about some of our lockdown approaches is they lack that humanity and they lack the reality, and they're based solely on one piece of epidemiological data. Univariate analysis always fails.
Well, look, there's been a terrific conversation, and we're running out of time. I might just go to you, Fiona, for the last word, and put you this thought. We know how governments are inclined to respond at times like this, to respond to obviously concern in the community and real need in the community. They will respond very often by trying to throw money at the problem, to try and announce schemes, put $50 $1 million scheme here and a 20. You know how it is, and Labor governments I like to think are a lot worse at this than coalition governments. But Liberal governments are not immune to this. Is that the answer? And you've worked in mental health. You're now in government on the government's benches. Is it a question of money, or is it that we just don't know or are not good enough at spending the money we've got wisely in mental health?
My definite answer to that is it's absolutely not about the money. It's about utilising what resources we have in a really smart way. We have a number of issues with our mental health system in Australia. One of them is the workforce. We have a limited number of people to be able to work in the mental health workforce. So it's about utilising them in the best way, and technology can be the answer to that in terms of being able to triage and assist. And certainly telehealth has been, as we mentioned earlier, has been an important part in assisting people during this period. But it's about using the money wisely. And one way to do that is to invest in early intervention and prevention in the early years, right from preschool and all the way through school, because that's where we can really prevent a lot of mental health issues, and we can certainly build a more resilient nation. So early intervention and prevention is where it should be spent, if it needs to be spent anywhere, and just streamlining our mental health system to make it less, a lot of people describe it as being fragmented. So pulling it together and reforming it is important, but it's not just about spending money. We can definitely save money, and we can certainly make it more efficient and more productive, and we can save more lives if we reform it to work at its best.
Saving lives and saving money, what a wonderful, wonderful idea on which to end. Thank you very much to our guests for giving us a very stimulating conversation. There's a lot more we could have said. I hope this will be a conversation starter rather than just a one-off conversation. But thank you for joining us. Thank you, Dr Fiona Reid, Dr Belinda Khong and Pete Shmigel. And don't forget, you can subscribe to the Menzies Research Centre. Over my shoulder, you can see a QR code. Don't be alarmed, I'm not going to make you sign in. But if you can click on that and become a subscriber, or just join the newsletter list so you'll hear everything about what we're doing, please do that. You can subscribe from just $10 a month. Thank you very much for watching. I'm Nick Cater for the Menzies Research Centre.